When you look at your life, can you see causative factors that have led you to change the course or direction of your life? What have been your greatest trials, your most heartbreaking moments? How did these experiences change you, mold you, and help determine the direction of your life? What were the lessons that you learned? What was the key of knowledge and experience that you brought back to your loved ones? What was the gift that you brought back to the world? You're about to hear the true, unknown experiences from some world-leading experts. They're about to share with you what it was that shifted the course of their life. You'll see what these people actually experienced and how the course of their life was irreversibly changed. It's through our collective journey that we find the path to our own healing. So often the answer to the problem you're facing lies in shadows and the darkness of something that you don't understand. Sometimes it's the power of the human story that illuminates your mind and reveals the long-awaited solution. Sometimes it's because you haven't truly identified your why when it comes to the reason you're striving to get better. When you don't have a reason, you're not fully committed, and the result is almost inevitably going to be utter disappointment. But when you find your voice, when you resolve yourself and set your heart on your target, amazing things happen. As you hear from these unique and invaluable stories, consider your life, your journey, your mission, and your path to health and healing.
There are studies that show that when one person changes their life, when they go from being sick to healthy, it dramatically affects the 7 that are closest to them. But how could it not? On a regular level, which is, if you're too tired to play with your kids, or kids feel energy, they know that you're dragging yourself through it versus being fully present with them, right? And when that changes and you're just in it with them and you're enjoying, or, you're present in the rest of your relationships, or career choices are different, creativity abounds, and that just affects everyone around you. And so, yeah, that's really special. That's the why behind I do what I do. I think ever since I was younger, that I can remember, I always wanted to somehow contribute to world peace. And I was studying, I wanted to be a diplomat, I was headed towards peace and conflict resolution, but yet my health was a mess. And when I changed my health, just by chance, stumbled upon a life-changing workshop, it was like life's defining moment, I really realized I'm a completely different person. And world peace starts with inner peace, and we have to get the health of our body as the foundation to allow us to have that peace. And so that's really kind of what sent me on down this path for holistic nutrition. I feel blessed, and it feels like an absolute privilege. And I think there's no greater joy in life than feeling that you're living your life on purpose. And I was here when Liz Lipsky was here, and she used Oprah's quote of, "We want to use our potential." And she said, "Use me up," is the quote that Oprah said. And it's, you want to be able to give as much as you can with your very short time here on earth.
Wow. And for you, there's an easier path, and it's just to say it's not your problem, and to just feel that you've either done enough, or there's a lot of different things you could pursue. You've got the world at your feet, but what does that feel like for you to think about just finishing and just saying, I've had enough, I don't want to do this anymore? What does that feel like?
I had a visceral response in my body, like when you said that. It's like saying, stop breathing, right? If you can't do what you feel like you're here to do, you feel like, well, what's the point then? Why am I here? So that's not an option. The only challenge is, yes, to make sure you are making time for those closest to you. You are making time for self-care, that idea of heal thyself. And I think a lot of us burn ourselves out, or sometimes we have to focus. Yes, we fill up with the nucleus, with those closest to us and ourselves, so that you can't feed from an empty cup, right? And you go out and you have more to give others, and you can give it with greater ease and greater grace.
Can you remember, and just in your experience, and I think that you've had those experiences, and you always continue to have experiences as long as you're engaged in the work that you are, where you will actually get to look into the eyes of those that you've been working with or touching and influencing. And I want you to go back, and I want you to think about some of the families, and a particular family, and see what's coming to your mind. And it's a family that was in dire straits, and you could see in their body language, and you saw the fear that they were experiencing, you saw the loss of hope, and then you saw things totally turn around after they were working with you and seeing that success. Can you remember it? And can you remember that?
Oh, it's just trying to choose one. That's the challenge. There's two that really come to mind, and one, which I know Dr. Tom would really resonate with, was an 8-year-old little girl who came to me, and she couldn't perform in school. Her neurological system was shutting down. She would maybe have a bowel movement once every 8 to 10 days, and it would have to be induced. And her parents had taken her to every doctor imaginable. They couldn't figure out what was going on. We looked at gluten sensitivity, then we dove a little deeper. We found out she had celiac disease, and so you're on this journey with them. So that feels like the worst thing in the world to the family, because now everyone feels like they've been poisoning someone they love, right? Feeding them gluten, thinking this, and then you take them on this entire journey of no, now we've found the problem. This isn't, I always say, it's great news. You have celiac disease. She doesn't have to suffer anymore because now we know what it is, and we can heal from it. She can live a normal, healthy, happy life. And hey, guess what? The rest of the family is going to get healthier because everyone has to do this and change their diet. And she's going to have a completely different life. They don't have a sick person in the house, and everyone feels completely different.
You know, they say the people who are the happiest have two qualities, and that's gratitude and lifelong learning. And I thought that was so beautiful, because one thing I do feel is a lot of this comes from a heart that is full of gratitude. The fact that I'm living today, I battled cancer 15 years ago and won. And so I have a passion for life and for living, and for the fact that I was saved from that to have my purpose, which is to heal and to learn. So I'm always learning, and I love finding out the new things that will help my patients.
Oh, wow. Well, tell me more about that. 15 years ago, what happened?
Yeah, so 2001, I was a 25-year-old medical student.
Right.
And you know, those young people, and I was one of them, you think you're invincible.
Yeah.
You have no concept of mortality or fear or any of that. And I found a lump in my breast, and once again, even though I knew it could be something serious at 25, my chances of having something serious were like winning the lottery.
Yeah.
So like 1 in 250,000. But I got it checked out and found out very quickly that I had a very, very aggressive breast cancer. And as most physicians know, this disease in young women is a whole different ball game. I was with a group of women under 40, and there was 12 of us in Chicago as a support group. I'm the only one living, Tom.
Oh my gosh.
So what you realize very quickly is, this is a battle for my life. And because of that, because of the aggressiveness of the cancer, I pursued all the conventional chemotherapy, radiation, multiple surgeries. And my life changed right away. I stopped medical school to take a leave of absence so that I could pursue the treatment. But I had always believed that there's a way to heal disease by looking at root cause and finding nutritional ways to help. So at the same time as I pursued all the chemotherapy, radiation, all the toxic therapies that were helping me, but very, very toxic, I was also seeing a naturopath. I had friends praying for me, so I had multiple things as well. And I tell my story nowadays, and I say these last 15 years, I cured the cancer through the chemotherapy, not I, but it was cured. But since that time, I've been healing from those toxic chemicals. My gut and everything else has had a profound effect. And about a year after my cancer diagnosis, I had just beaten the cancer.
Yeah.
I found out I had Crohn's disease.
Oh my gosh.
Which is very relevant to your summit, because it's obviously a critical autoimmune disease that is reaching epidemic proportions.
Yes.
So then I faced my second life-threatening illness, a 26-year-old this time.
Oh man.
And I sat with my gastroenterologist, Tom, and he told me, he said, Jill, you're going to need lifelong medication that suppresses your immune system. You probably will need multiple surgeries. You may lose your colon. And when I asked him, can I do anything with diet? Because in my heart I knew that there's got to be something I can do.
Sure.
And I was pretty naive back then. I didn't have all the answers that I have today with autoimmune disease. But what I did know is he looked me point blank and he said, Jill, diet has nothing to do with it. I knew. Talk about intuition. I knew that wasn't true. So I fired him and I went on the path of that lifelong learning to try to find answers for myself.
Yeah.
And I think most great functional medicine doctors, they start with a desire to either help themselves heal or a close friend or family member. And what we realize very quickly is our conventional training is powerful and has given us an incredible foundation.
Yeah.
But it doesn't have all the tools when we face battles like this. And so what I found is very shortly after that, I came across the Lane Gottschall specific carbohydrate diet.
Yes.
And I said, what the heck? What do I have to lose, right? Let's try it. 2 weeks, Tom. No fevers, symptoms almost gone. I wasn't healed, but I was remarkably recovered in 2 weeks by changing my diet.
So you went from this place of a GI doc literally staring you in the face and saying, there's no hope. There's nothing you can do.
Yeah.
Just expect to lose your colon, expect to be on immunosuppressant medication that's probably going to have lifelong side effects as well. And then you went and said, you know what, wait a second, something in me is saying something that you're telling me is wrong.
Right.
Now, that's an interesting place to be in, right? You have that voice that's speaking to you, and you actually listen to it. And you went and found something. And what I'm seeing in clinical practice, and Jill, I don't know what you're seeing, not everybody listens to that voice. You know, so many times we have this indoctrination of MD knows all.
Yes.
Right? The master. Right? Now, wait, you went through conventional medical training. Can you describe this to me? Where does that come from? Because I didn't go through that training. So where do you think that mentality gets built up?
Yeah, so I'm a medical doctor, MD.
Yes.
And I went to Loyola University in
Yes,
Chicago, Stritch
yes.
School of Medicine, great place, had a great education. But I think we were talking before the interview how much that the humanity and the intuition is ground out during the training. You're in this survival mode. I would do 36-hour shifts, sometimes zero sleep, and then you'd go back the next day and do 12 hours, 12 hours, 12 hours, 36 hours. Once in a while you get a day off. It averaged a couple days per month you have off. So not only were you going on, you know, not great food because you didn't have time to really prepare, lack of sleep, stress, and in addition, there's this idea that if you aren't taught it in medical school, it doesn't exist. And even now we come up against this with our colleagues, like, oh, well, I've never heard of that. You know, that can't be true.
Yes.
The microbiome and heart disease, like who knew? There's a total connection, but you know, oh, well, we weren't taught that. And the other piece that for me was so powerful rediscovering is that inside of us, I think women even more than men, but both sexes, there's this powerful, we can call it intuition, gut healing, spirit, where if we really, the core of functional medicine is problem solving and analyzing large masses of data and collating them to make sense out of that, right?
Yes.
And our subconscious can work so much quicker than our conscious mind.
Ah.
So when we sit back and allow that to kind of filter through the whole listening to the patient's story and just hearing with an open heart, ready to, you know, respond to what they have to say. Often our gut instinct, our heart, our intuition is powerful and comes to the answer well before our conscious mind. And for me, we talked about medical training kind of grounding, like the science was so ultimate that that sense of intuition was pushed aside. And coming back to that for me has been one of the most powerful tools in my clinical practice today, is starting to hear the story and have this sense of, oh, I think this might be the direction I should go. And what I do is I trust that intuition to make some initial either plans or testing or whatever. And then I follow that up with science by testing to make sure my hypothesis is correct. So once I have this intuitive sense of a path that that patient may need to go on, or maybe an underlying trigger or cause of their autoimmune disease, I will say, okay, this is what I think might be going on. Let's prove that with science. So you still use the science, but you often trust that little voice inside of you instead of just saying, oh, that has no value, because it has powerful value. And the other thing is, as we as clinicians have more and more experience, that experience colors our view of how we see the situation. So we can, in the back of our subconscious, say, I remember seeing a pattern like this before, and it ended up with this diagnosis. And if you pull that in often, you'll see that pattern recognition come to fruition in that patient as well. I remember my husband looking at me when I took off my bandages and I was scarred and I had had surgeries. And he said, Jill, I don't care. I'm going to love you no matter what. that is so powerful, to have the unconditional love of someone that you know, no matter what comes, no matter what scars you have, no matter what you look like on the outside, they're going to love you and care for you for life. That's powerful. And we've been married almost 20 years now, and it's a great relationship. And you know, the cancer made us stronger. For some people, it makes them weaker and it destroys their relationship, but for us, it was stronger. By allowing me to feel safe and loved in that relationship, there was no way I would be where I'm at today, or doing what I'm doing, or impacting other lives, physicians and patients, without that, in my most intimate and core relationship, that sense of security and love. Suffering, none of us like it, but it is inevitable. We will all, at some point in our lives, experience suffering, and you can either choose to embrace that and find how it will make you a better, stronger person in your relationship the same way, or you can choose to be bitter and to become hopeless and to let it destroy you. And you are at a fork in the road right now. And if you choose to become a better person with purpose, that suffering can transform you into the most beautiful thing you've ever become. And if you choose to allow it for you to become bitter and to destroy relationships, you're going to be the most miserable person ever. So you have a choice right now. And that choice is to take suffering and allow it to catapult you into greatness.
I'm told that you are you love people, and that it's a nice thing to have people say about you. And I understand it influences your practice. Like the direction, what you do for people, all stems from the fact that you have a deep love for people, and it's like somehow within that's where you're going to find the answers. What's it like to be in that experience of actually, like, I think a lot of people try and protect their hearts or shut their hearts off from their work with people, but you actually do the exact opposite, where you allow your heart to open to somebody. But what's that experience like for you? What does it feel like?
That wasn't how I started. I remember when I first came to Ashland, there was a group of people that I got to be friends with, and we did a party game. I don't think this can be put on tape, but this is an interesting story.
Yeah, tell us.
To answer to your question, and the party game was that you selected someone that left the room, and then you selected someone that was there, and then the person came back and tried to identify that person that had been selected by asking a question. And the group dynamic was you had to answer truthfully. So when the person came back in and I had been selected they were going to try to find out who I was. They asked questions like, if this person is a kitchen tool, what kind of kitchen tool? It wasn't flattering. It was ice pick. I mean, things that just destroyed me, because it was so true. I had come from a family that if I hadn't defended myself, I wouldn't have made it. And I left that game. I mean, I put on a good face and we all had a good time and drank too much beer. But I went home and I said, I love those people and they don't have any idea. And I said, that won't happen again. But you can make that statement, but you have to go through some pretty deep evaluation to figure out how to change your habits. I was tall. People thought of me as being very English-like, very distant, very scholarly. And it was just all a facade, because I could be so easily hurt, and I had to learn a different way of protecting myself. And the way that we're taught in medical school was perfect for my defenses at that time, but it didn't work for me as a physician.
Wow, that's incredible. I really appreciate you sharing that part of your life with us. I think it's so important, and I think that you're doing such a justice to the cause of the profession, and it's just a really beautiful reflection, because you made a change, and for you, when you were making that change, and when you were actually allowing your heart now to open up to people, and it sounds like you felt ashamed that you were perceived that way, and that you'd guarded your heart for so long, and so many words that you could have said, or so much affection that you could have given during that entire, chunk of your life was not there. But what was it like to seize the day and, reclaim some of that, and coming back into those important relationships in your life, and then coming to your practice like that? How did that feel for you to then step into a new direction?
Well, I think that had a lot to do with how we developed what we call the heuristic, or the way that we actually train professionals that are already functioning as healthcare providers. How do you do functional medicine differently? And we call it the go to it. And the go, the G, is first you gather information. A lot of that's done before you see the patient. But then you gather yourself. And we talk a lot about how would you go about gathering yourself? How do you leave the phone call you just had with the hospital and someone, their biomarkers are going hell in a handbasket, and you're supposed to walk into this room and be present, authentically present? It's possible. I mean, you can develop, if you know that's what will get you what you want. Because I always take a minute before I walk into a room and ask myself, can I let magic happen? Because for me, magic is what I can't anticipate. If I go in thinking, this is the problem, this is what we're going to do, how did you do with what we suggested? Magic never happens, because it's preordained what's going to happen in that environment. So I have to go into that room if I really want something to happen, and it's really boring if something doesn't happen, because nothing changes if something doesn't happen. And then some of those stories I tell come up, because if you go into a room like that, I had a woman that had serious ulcerative colitis, bloody mucus, with no past history in the family and whatnot. And I tried all the things that we usually do, and then I walked into the room after I saw the note from the nurse that nothing had changed, and I'd seen the woman a couple of times, and I sat down with her. And I said, well, it sounds like nothing's really changed. And she said, because I had created a situation where she needed to tell me the truth if we're going to find answers to her problem. And she said, no, really, nothing's changed. The things that I tried, I was diligent in doing what you said, or what we agreed to do, but nothing has changed. And I said, well, I'm going to step out of the room. I'm going to ask Dr. Green to come in. Because, no, actually I said Dr. Brown, but it's been one or the other at different times. I'm going to ask Dr. Brown to come in, and he knows probably more about your problem than I really know about. And you need to tell him the story. So I walk out, I come back in, and I introduce myself as Dr. Brown. And I say, Dr. Jones asked me to come in. And so we played this charade, and I've done it a number of times now, and it always works out the same way. Because I come in and I say, I always say, what is it that you haven't gotten Dr. Jones to understand? Because you probably told him. And then they tell me. And in this particular instance, it was, I've tried all the things that Dr. Jones suggested, but I really think I'm really in an abusive relationship with my employer, and my family really needs what I make. And I asked her, the second question was, well, do you have an answer? She said, yeah, we have a business plan. My husband and I want to open a cafe up at this little area outside of Ashland, and we can't get a bank loan. And so we talked a little bit more about it, and I said, well, it sounds to me like I should write a prescription for a bank loan, but since I'm not a banker, why don't I call my banker and have him work with you? Well, she was a woman, and they were really pushing small business loans, and they opened a cafe, and she's never had another day of ulcerative colitis. So that's what I talk about is that won't happen if you go into the room knowing all the molecules and knowing what you've been taught. You're going to find those answers. What you do is you bring all that information with you, but you wait to see what, of all that stuff I know, what is even relevant to this problem? And you're going to tell me, and then I'm going to stop listening and talk to you. But I need to listen, and you will tell me things that will somehow get sorted in my brain because we have this amazing ability to look for patterns.
I take all of my experiences in life as a message, as messages for me in terms of what I should be doing. My dad, in his struggle with Alzheimer's, lived in an assisted care facility that was shared a parking lot with my clinical office, meaning that I would be visiting with him every morning. When he wouldn't remember my name, then I'd walk across the parking lot and go into my office and see Alzheimer's patients. So it really reinforced the notion to me that this is an emotional event, that I knew what parents, what the children were going through when their parents suffered the disease. And I think it made me clearly a more compassionate and a more understanding physician. So that was the lemonade that I made from the lemons. I think it has really encouraged me to do what I can to amplify the message that this is a preventable situation. It's a devastating event in a family, and it's heart-wrenching. But you know, I will say that it was a powerful lesson for me. I don't think it was clearly, you know, a lesson of his choosing. It just how things unfolded. But I think it, as I look back in terms of my destiny, I think that experience, I've worked that experience to a very positive place. You know, there's a song, The Leader of the Band, and at his eulogy, I actually sang the words, "The leader of the band is gone, and his eyes are growing cold, but his blood runs through my instrument, and his song is in my soul. My life has been a poor attempt to imitate the man. I'm just a living legacy to the leader of the band." And he set the bar really, really high in terms of compassion, in terms of what it means to give back, not just as a physician, but as a fellow human being on this planet. And I will carry that with me always. But I think back about all of the times that we interacted, which weren't that common because he was very, very busy. And, you know, just thinking back of being once on a boat, and he caught a little fish, and he took the fish off the hook, and we weren't going to keep the fish. He threw the fish back in the water, but the fish struggled. And my dad watched that fish as it floated away and kept saying, "Come on, little fish, come on, little fish." And it was just the compassion for the little fish, which, you know, years later I would go to work with him in the operating room and even in his office seeing patients, and he would treat people the same way. Just, "Come on, little one." And you know, when he would walk into the hospital, it was a moment. First of all, I could barely keep up with him because he walked so fast, but people would get out of his way and just pave the way for him to do whatever it is he wanted to do. I'm not sure what you're going to do with this material, but there's one story. My mother and he were traveling once, and she had cut herself or something. And he walked into an emergency room in some other city where nobody knew who he was, and he immediately called for a surgical kit, and "I want this, and I want that," and the entire emergency room snapped to, and he probably wasn't even licensed where they were, and he sewed my mother up, and that was that. And it was just, that's the kind of guy that he was. So I've not shared that story with anybody before. But in those years, we didn't have the data that we have now. We didn't have the work of Dr. Kirk Erickson at University of Pittsburgh, who demonstrated increased size of the brain's memory center, the hippocampus, based upon aerobic exercise. We didn't understand the powerful detrimental role of mild elevations of blood sugar on the brain. So we didn't have the data, and I can't ever fault myself for not being able to act. We didn't know this. Well, we do know it now. So in moving forward, we learn from our history, and we're going to make the future a better place. Because now we have the data, and the mission here is to get that data out so that it can be leveraged in terms of making people aware of the importance of making these lifestyle changes now while the sun is shining, as opposed to waiting until it's raining and then trying to fix the roof.
You know, as I think back about my entire lifetime with my dad, he gets bigger and bigger in my eyes every day.
Cool, Dr. Ash. I want to ask you about, with this subject of autoimmune disease, what your experience has been with real life people and seeing the suffering that the planet, people are experiencing today. What have you seen across the board?
Well, over nearly 30 years of practice, of course, I have a wide range of patients presenting. I guess probably the most challenging area that I worked in was within autistic spectrum disorder. A large part of that can be looked upon as an autoimmune disease because there are disturbances within the individual's immune system that leads to a manifestation of behavioral changes. The second thing is with inflammatory bowel disorders, where we see an increasing number of people presenting with either functional, which is IBS type problems, or more pathological problems like Crohn's or ulcerative colitis. There's been a 25% increase in the last 15 years in the presentation of inflammatory bowel disease. This is absolutely a reflection of a loss of relationship between the environment in which lives inside them and the human that's possessing that environment. So people become incapacitated, codependent upon strong painkillers or different types of medication. And the result of that is always leads to a compression of life choices. So when anybody presents either with an individual which has a distinct pathology they already have, or with a series of symptoms yet to be diagnosed for a pathology, but they're progressing in that way, they have had to give up aspects of their life. And nobody likes having bits of their life taken away without their own individual decision to make it happen. So I think humans adapt. And it's not until you give people back and it opens up that route so it returns to function again that they realize just how limited their choices have become, how constrained it should have become. So I remember, for example, one chap many years ago came to see me with just irritable bowel syndrome, which is exceptionally common and in severe cases completely debilitating, but it doesn't fall into pathology. And he was been married for 30 years, and he'd never been more than 20 to 25 miles from where he lived for about 15 years because of his fear of being unable to move away from the toilet that he felt comfortable about having access to because he had frequent explosive diarrhea during the day. But he really wanted to take his wife away to celebrate their 30 years of wedding, and so of marriage. So we intervened with some changes, which was modifying some diet, giving him some organisms that helped to switch off these inflammatory markers inside his gut, reduce the intensity or frequency of activity. And within 6 weeks, he was making that journey to 30 or 40 miles. Within 3 months, he booked a holiday to Paris. Now, that's a very simple notion that an individual who's compressed his life to geographically 25 miles, suddenly 3 months later, we've liberated his choice that he can now fly to another country. So confident is he in the way that his functionality has returned.
What did the change look in him? What kind of change did you see?
Complete disbelief mostly, because I think it's reasonable that most husbands do not come and seek health until something's falling off. So to come and ask for help, it was very embarrassing for him to talk about this. I remember it. I live in a rural part of England, and it was very embarrassing for him. But I still see him now. It's just 10 years ago he did that, and when I see him, he puts his thumb up and say everything's fine. So having had the history, nothing can be done. All you got to do is accommodate this. So I think from a very small aspect like that to returning people in my work with autism, getting people losing their diagnosis of autistic spectrum disorder, returning to a degree of normal school, going back into mainstream education again. That sort of shift from somebody's life doesn't just affect the individual, it affects everyone around them. And so in the same way as we've been discussing today that external pressures being brought to bear on the internal environment inside of us, when we correct that internal environment, the benefits manifest themselves externally as well.
Did you ever meet his wife?
No.
Never? Yeah.
No, I haven't.
Did he ever, because they went on this trip to Paris, did you hear of how it went for them?
Yeah, of course. No, I had a fabulous time. Yeah, it was a fabulous time. I mean, it was, genuinely speaking, it was not something he ever imagined could occur. So, here's my dream, but really it isn't reality. If I could go 50 miles from home, I consider that to be a great success. No, it feels great. And it's a strange little vignette to pull out of thousands and thousands of patients, but I think what was important for that chap was it was just such a complete revelation. But anything could occur that would make him feel better. I did, last year I had a lady came to see me who had a very aggressive Crohn's disease. She was on a powerful immune suppressing medication called Humira. Her gums were receding, her skin was breaking out in infections, she was completely fatigued, she was feeling depressed, she couldn't cycle, she couldn't do her job anymore, she was still getting bloody stools every day, and she was lined up for a resection, so surgical removal of the colon. And so she was referred to me by a colleague of mine, desperate phone call, we had the conversation, and I instigated an intervention program for her. Now here we are 18 months later, she's cycling 100 miles a week, she's on no medication, she doesn't have any surgery, she's had 25 years of inflammatory bowel disease and she has virtually no symptoms whatsoever and no drugs to control it. So again, what happens there is you take someone from an absolute decline in function capability, when they're willing enough to engage in a change that perhaps no one gave them a structure before, it was ideas or projects that they might want to take. The only solution she could see was taking her colon out and going on to a colostomy.
She must have been terrified.
Yeah, of course. Plus, I think also I know from her own talk was since she'd been taking the medication, her gums were receding as a secondary side effect of taking immunosuppressant medication. Is she was worried her teeth were going to fall out, so she was going to have a colostomy bag and no teeth. She was gaining weight. She was non-functional at 39. I think she was 39, 40 years of age. These are not projected images you want to be wrestling within your head.
Do you remember, like, when she come into your practice, do you remember that, like, I can't imagine what it'd be like to be going through that personally. I just, I've never had things quite like that happen to me. This woman must have been at her wit's end. Could you see it in her face?
Yeah, sure. I think
did people fall apart in your practices? Like,
yeah, well, of course. I think it's the nature of any intimate relationship. I think here's the thing: is very, very few people, really very few people, ever get someone listening to them with total integrity for half an hour. It just doesn't happen. Conversations are going on, people moving around. So to come and bear your fears to what is effectively a stranger, you're handing them your hope, your worst fears, you're giving it to them as much as you feel you can on that first visit. Obviously, as time goes on, more layers get uncovered. But effectively, you're saying, here's me, here, and it's really awful. And you have to sort of pick that person up and give them a reasonable, practical, honest and fair solution, if you can, to what's going on. And so at that very moment in time, I think that connection, that relationship between the clinician and the patient is at its most powerful. And we refer to this as a meaning response. This is where if you listen, completely listen, don't interrupt, and hear what that person has to say, they'll often give you a lot of information in that conversation that allows you to intervene at exactly the point that they're willing to accept that intervention, that's powerful enough to have an effect, but not so fearful for them that they won't engage in it. And then having given that explanation in a way that makes sense to that individual, that they feel that you now have your support and cohesion, that you can perform a cooperative relationship, you engender a healing response in that individual far greater than the delivery of a probiotic or a change in diet. And that's the, if you like, the ethos or the absolute core of what makes a clinical decision translate into a therapeutic outcome that's often far better than both I and they anticipate at that time. I think most people who present with a history of ill health have already projected forward what they see their life as being like. Most people come to see you with a vision of where they're going to be, and what they're looking for is somehow or other changing that vision. Often don't think about reversing the position, just having a different perspective of what they might be in 6 months or 6 years' time. It's perfectly normal within that discussion for people to reveal 2 or 3 meetings in that they would see somebody who was worse than they were at that stage, perhaps completely incapacitated, and they would place themselves in that person. So humans are, by their very nature, projectors. You know, we project ourselves, we're going to be successful, we're going to be able to do something, or worse when it comes to ill health, we'll project the worst case scenario, particularly where they feel unsupported, unstructured, they've had no satisfactory diagnosis, they're running out of options, medications declining. So health is an incredible gift when you never have to think about it. The moment it occupies and fulfills or completes every part of your waking process, all your decisions are based around your health, you change your life completely. And the gift, if possible, it's not possible for everybody. I don't want you to think that this is reverse for every person that comes, but the real gift of any good healer, of any good clinician, is to be able to take away that self-imposed list of what you can and cannot do, so that it returns to a far greater and more expansive range of options, because that individual now feels they have control. And if we don't have, or we can't impart some level of self-determination and self-control, then we've really failed as a clinician. If we're simply saying that here your responsibility is simply that you have to take this, nothing else in your life needs to change, just take this, and we'll compress your symptoms so that you can function again, that's not healing. Healing is about educating, so that their sense of investment in that progress allows them the ability to influence the outcome in corroboration with you, and ultimately, hopefully without the need, or with as little need for medications or supplementation or other things as possible.
My family doctor when I was a kid, when I was 10 years old, was Dr. John McDougall. And he was presenting, you know, I used to go to all his presentations because my mom was my babysitter, so she brought me along everywhere she went. And he made a comment once. He said, look, 76% of our connection to the environment happens through our food. He said, we're either working so we can pay for our food, we're preparing our food, we're shopping for our food. There's a huge connection to the environment with our food. And as a kid, I grew up in Hawaii in Southern California, so I was outdoors all the time. My grandfather was an outdoorsman. And I really appreciated nature. I really appreciate the outdoors. And so I thought, wow, you know, if I want to change what's happening with the world, I need to change what people eat. A part of me wishes none of this was happening at all. I'm a very sensitive human being, and I have a lot of feelings towards my children. I love my children dearly, and I love the outdoors dearly. And to see the air being polluted and the water being polluted and the land being polluted, and to see my children being polluted is a little too much sometimes. When I evaluate the data and I see not just one study, but hundreds upon hundreds of studies, all warning us that if we don't make change, and we make change quick, it's not going to look good. And I take my role as a provider and protector for my children very seriously. So it's almost too much to evaluate all this data, to educate other practitioners about it. I mean, I lecture for IFM on detox, and yeah, I wish it could go away. I wish we could just bring a big old fan in here and you know, in a fishnet, and scoop out all the toxins from the ocean and clean out the blood and the brains of our children and let it all go. I guess, you know, I wish I could be a lobbyist on Capitol Hill, and I could talk to the politicians and show them all the scientific research. I wish I could be a parent organizer who could go around and organize all the parents in our local community and inform them everything we already know about chemical exposure and eating organic foods and avoiding different things. Absolutely. And somehow I wish I could be some sort of motivational speaker who would just tell people, look, you're worth it. I think that's the biggest issue, Jonathan, is I think people don't understand that they're worth it. They're worth clean air. They're worth clean water, clean food. That they don't need to be trapped in houses absorbing all these toxins all day long and suffering from disease. They're supposed to be very bright, very strong individuals. They're supposed to have a connection with the outside world. They're supposed to feel vibrant health all the time, be excited about life. That's what that's what they deserve. And I think because people don't think that, it's so easy for them to turn on the television for 6 hours a day. I'm worth nothing. I'm worth sitting on a couch and absorbing this information that's being fed to me. Passive. I'm not a creative. I'm not a person who could get up and change the world. But each person, individually, if they all got up today, we would change the world. So that powerless place is just that. It's powerless, but it's all in your mind. So the minute we switch the consciousness, I think that's when we make the change.
When I talk to doctors about a sensitivity to gluten, many doctors say, oh, I know about gluten. And I say, really? Can you tell me why in the journal Gastroenterology, in the largest study ever done on celiac disease, gluten sensitivity and celiac disease, that if you are diagnosed with celiac disease as an adult, you have an 86% increased risk of dying of cardiovascular disease in 1 year after diagnosis? Or can you tell me why children diagnosed with celiac disease have a 3-fold increased risk of suicide after diagnosis? After diagnosis. That means they're on a gluten-free diet. Can you tell me why that is? And doctors, they've never heard this before. This is the largest study ever done on celiac disease and mortality, right? And when you look at those statistics, what that tells us, if you read the statistics, what that tells us is doctors missed it. They miss it. They think if you have a sensitivity to gluten, just go on a gluten-free diet and you're fine. Well, that means kids have a 3-fold increased risk of suicide within 5 years. 3-fold increased risk. So I want to make a change in that. So the gluten intolerance group has summer camps for celiac kids. And they did this really smart thing. They have summer camps in a camp with regular kids. So it's not all celiac kids, it's just kids. And those that have celiac disease, there's a separate kitchen for them. Everybody eats in the same common area. There's one cafeteria line, but there's a separate kitchen to prepare the foods for the celiac kids. So what the gluten intolerance group did is they brought in a chef to cook the food for the celiac kids, whereas the food for the other kids in the camp is the regular person that works for the camp, and they buy the big cans of tomato sauce to make the pizza and all that stuff. But a chef makes the food for the celiac kids. It takes 2 days before the kids eating the regular food, they want this food because it tastes so much better. And with that, the GIG group, gluten intolerance group, has classes for these kids. Say, do you notice how the other kids, they want your food? And they say, yeah, that's so cool. Well, what's it like back in school? And some of the kids will start crying. They talk about how mean their kids are in school, and they think that celiac kids are weird because they won't eat pizza, and they eat this silly food like rice crackers and whatever they eat. And these kids, it's called social phobia. These kids develop social phobia. They don't want to go to school. They don't want to go in the cafeteria. They don't want to go out with their friends on Friday night because they're looked upon as weird. That's one of the main causes for increased suicide in these kids. Their self-worth is just in the trash. So what the GIG group does is they have these discussion classes with the kids at the summer camps and let the kids see, other kids, they want your food because it's so much better, and your kids back in school, they just don't understand. They just don't know. Oh yeah, they just don't know. So what are you going to say to those kids when you go back to school? And they start giving these kids game plans of how to deal with the lack of knowledge.
And they get a confidence, yeah?
They get confidence as a result, so they're not as much at risk of being impacted by the names. Oh, whatever they call kids, I don't know what they call them, but they call these kids names because they're celiac kids and they don't eat regular food. Mm-hmm. They call them weirdos or whatever they call them, right? Yeah. So they've got confidence and they've got a plan as to what to do. We need to stop this. We need to stop the suicide rate. we need to stop these adults that die after diagnosis. It's an 86% increased risk of dying from cardiovascular disease and a 280% increased risk of dying from a tumor in the first year after diagnosis for adults. Those are the statistics. Now, what happens after diagnosis? You're put on a gluten-free diet. That's the only thing that changes. And you have this increased risk of early death.
You said 280 for tumor. What did you say?
Tumors.
Yeah, tumors.
Right. It's a 280% increased risk of dying from a tumor the first year after diagnosis with celiac disease for adults. So it's 86% increased risk of dying of cardiovascular disease in the first year after diagnosis, and 286% increased risk of dying from a tumor.
Why do they have risk of getting tumors?
They had it already. It was under the surface, but now it just rears its ugly head up. The cardiovascular disease doesn't develop in the year after they're diagnosed, but it rears its ugly head up, worse than ever.
Tom, what happened to you when you were back at, as a clinician and seeing patients with some teenagers that you saw, and or people?
I've lost 2 kids. I've lost 2 patients to suicide. How do you look a patient in the eye when their son just committed suicide? Both of them had just started working with me. I hadn't seen either one of them yet. They were still in the testing phase. Both of them. What do you say to a mother? So I committed right then and there, not on my watch. Is that going to happen again? Not on my watch. Well, what do you do? Because I hadn't seen them yet. So what do you do? I carry the message out. I read the studies. I look at what this stuff says, because the scientists that are in this field, they're not functional medicine practitioners. Perhaps they're clinicians in traditional medicine, which is in the silo of whatever disease they're dealing with, but they're not functional medicine practitioners looking at the big picture of the triggers. So the best that I can do, I think the greatest impact I can have, is to carry this message out to as many millions of people as I can. That you just need to know about this, and then check. So that doctors, you don't have a patient that commits suicide on your watch. This doesn't happen to you because you know how to treat this thoroughly. My father's sudden death would be the most traumatic thing that's ever happened, and the only way I could find to cope with that was one day at a time. And I also looked for a therapist to deal with the emotional volatility of all of the events that would come up, because if you don't experience the emotions, you hold them in. Where do you hold them? You got to hold them somewhere. If you hold them in your heart, you get heartache. If you hold them in your gallbladder, you get bitter. And so I needed to develop a better skill set at dealing with these emotions. And so I'm very grateful I did.
What do you see, and what's it like for you to experience people just turning their lives around and blossoming?
It's what makes my heart beat. It's really so satisfying to see the transformations that occur. And in the programs that I do, it's very diverse. It's not even like the outcomes are all the same, like everybody loses weight. I could have somebody that loses weight, or somebody that sleeps better, or somebody that has a better relationship with their husband, or somebody that, I remember one patient where she just told me that her whole life just got more colorful. She was wearing lots of black and lots of brown and white, and she just went and bought different clothing, and that changed her. So sometimes it's just like a little itty-bitty thing. I call it the small and sticky change. What is it that's going to propel you into more of who you are? So for everybody, it's all a little bit different, and it's beautiful to witness that process. It's really and truly, for me, it's about this message of authenticity, being true to who you are. And I think that this planet can benefit if we were all more of who we are. And we're not. We're who our parents wanted us to be. We're who society and magazines and media are telling us to be. So when I work with a lot of women, so when I see these women come clean of that and really get naked into the essence of what they're about, that is the most gratifying thing for me, because that's just my own personal life mission, this whole spirit of authenticity.
You went through that transformation yourself, didn't you?
Yeah. And I'm still going through it. I think it's a lifelong process, really.
Because you could easily go back there at any moment. You could go back to just following the rest of the tide, the masses, and just trying to perform and please people and be what people want you to be.
Exactly. I think one of the hardest things for people...
Yeah, it was a struggle for you in the past, wasn't it? I mean,
yeah, because I was a woman who was a scientist surrounded by lots of very intellectual men. And it wasn't easy to be a woman who is creative as much as intellectual to really make her way in this world. And then when I got out of school, I finished my master's, my PhD, then I went on to working in corporations, and I had more of the same. And I kept hitting the ceiling. No wonder I developed an autoimmune disease, right? Because I was in lots of endocrine disruption issues because I wasn't me. I was trying to fit into being a scientist. You know, even though I hated being in the lab late at night, I was like, I'm never doing this again. I want to work with people. I want to work with really inspiring people into what they want to be about. Who are they? So yeah, it is about my own personal journey. And again, I'm still unraveling and unfolding into that. I'm not perfect by any means. It's just realizing my imperfection and accepting that as I go more and more. One of the other things that I bring into my work that comes out with people that I work with is art. So when I was in my 20s, I had a lot of personal growth time. I was going through all of my schooling. I was in a foreign country. I was alone, and I was just really within my own space of, like, kind of a dark night of the soul, so to speak. And I started painting like crazy. And I would just get on the floor, and I don't even know what got me to do this. It was just kind of like, I just became really tuned into color. I started seeing people as colors. I started just, if I would have a moment, I would register it as something colorful. And so I would paint. I would paint these massive paintings, and I put them all around the space that I lived in. And I, as I continued doing that with really no rhyme or reason, it was almost like my left brain had turned off and my right brain had turned on, just making, and I didn't like making small things. It had to be massive, right? And it had to be messy. And I played loud music when I was making these paintings. So finally, I met my future husband, and you know, he would look at these paintings and he's like, these are your ovaries and your uterus that you're painting. You know, it's this common theme, these spirals, it's all very feminine. And I realized that, wow, you know, the femininity that I wasn't expressing for so long, it was getting squeezed out into my art, into this wild, chaotic, you know, I had no training in making these paintings at all, but who I was needed to come out in some way, shape, or form, and I didn't have children, so my creative expression was coming out in a different way. So I think with women, and especially the people that I work with, when I see them getting creative, because the biggest thing that I hear is, I'm not an artist, I'm not creative, you know, and it's like, you are. Every cell in your body is creating right now. You are a creative being. So once they have this revelation and they start really stepping into their own sense of their creative potential, that's really juicy for me. That really gets me, even more than the heady stuff of somebody biochemically just, you know, transitioning through their labs and seeing the numbers improve. That's just something on paper. That's not, to me, soulful. I really want to see the soulful aspects of where people are transitioning into. There is this, it's almost like, in some way, it's going to sound really strange for me to say this, but autoimmunity has appeared for a reason. You know, this rise of autoimmune conditions is getting us to look at what's going on underneath the surface, to look at these things of, why are we attacking ourselves? And I use that language with people. Like, what is going on? Why don't you love yourself anymore? You know, why aren't you taking care of yourself? So the whole issue of creativity gets women, and men too. Men also need to find their space in this. You know, I'm a champion for both, absolutely. So it's not a men versus women thing. It's just that I'm keyed into what I'm seeing and observing with women, right? Sure. So really helping them to connect to that creative sense that's in them. It's already in their body. So now it needs to come out in a variety of different ways. So as people get better, they might start to they might think about quitting their job. Let me just go off and like do the thing that I've always wanted to do and live my life stream. I've seen a couple of people like that where that has unfolded for them. It's not been an easy process because they feel really strapped, like you said, like a caged bird. Many of these people feel like caged birds. And they're not allowed to sing. They're not allowed to be. They're not allowed to be imperfect. You know, their imperfect selves. You know, continually checking mirrors and, you know, making sure that they look good. And, you know, there's this, I really just hope that women can be more supportive of other women in the space of, you know, being supportive. I think one of the elements of autoimmunity is isolation. And we know about sociogenomics, right? The whole idea of our social communities who we're connected to determine so much of our outcome, whether or not we do have disease. So if we're isolated, we're lonely, more inflammation, more autoimmunity. I've seen this. This is really something that I think both men and women struggle with. So when you start to love yourself, you begin to be free of disease. You know, that you start making the choices that are really focused on you and what's good for you, rather than thinking about what somebody on the outside wants you to choose. So then it starts to create this ripple effect. When you create that expansive self-love inside, you start choosing the foods that are good for you. You start living the life that is good for you. You start selecting the friends that are wonderful for you and supportive. So no more of this toxicity in all these different parts of your life that you've been cultivating. So you just break that, you break those bonds, and you create new ones. And that all comes and springs from that ability to love yourself. You can absolutely be free of autoimmune disease, whether you have it now or you're starting to develop something like that, by really tapping into that sense of loving yourself and having true compassion for everything that you're about. You've just got to do it. You've got to make that decision that you're worth it. Because if you continue to live your life for others, where every decision, every choice that you have to make is really in question and you're not really sure, you just have to really get aligned with that sense of love within you, for you. Get used to putting yourself first, because when you do that, everybody else will be taken care of. And I know you can do it. I've seen people do this before, and they have amazing transformational outcomes. And I'm part of that. You know, if I haven't seen it in my own life as I have, I wouldn't be able to tell you this.